On to Assam, where 844 fresh cases were reported, with Guwahati reporting over 300 of those cases alone between December 27th and January 5th. A 10-day period, there's been a five-fold increase in the number of positive cases. Now, the government has decided to ramp up facilities, and at the Guwahati Medical College, the biggest COVID facility in the northeast, a new COVID ICU is getting ready in the parking lot of the medical college. This has now been converted to a 200-bed ICU complex with ventilators.
Assam has started to witness a rise in the number of cases of COVID, perhaps indicating that the third wave has hit Assam. And in fact, there have been Omicron cases not only found in Assam but other parts of Northeast. Remember, right from the first wave of COVID which has hit in 2020, every time in every wave of COVID, Assam and rest of Northeast got hit by the wave about 2 to 3 weeks later than when the metros were hit, and therefore now this gives perhaps chance for Assam to prepare. Now we are inside an ICU which will be dedicated for cases related to COVID and particularly Omicron if Assam witnesses a surge. Now this ICU that we are in is now being readied. The equipments have come in, the ventilators have come in. At this moment, Assam has only 5% utilization of the total hospital beds, which is more than 8,000 available for COVID patients. And therefore, if there is a surge in the cases like what it is witnessed in Delhi or Mumbai, then Assam is also trying to ramp up its facilities, particularly COVID ICUs. Now this space that you see used to be the parking lot of Guwahati Medical College Hospital, which happens to be the biggest medical college in Northeast India and also the biggest COVID facility. Now this parking lot has been transformed into a ICU complex with ventilators. We are in the basement ICU, which will be dedicated for COVID, kept ready for COVID rather. It has 100 beds. There is another ICU which is on the top floor, which has been utilized as a general ICU with 100 beds but can be transformed into a COVID ICU. So therefore, the government here in Assam trying new means, innovative means like converting a parking lot of a medical college into an ICU complex so as to keep ready beds with ventilation, with oxygen if there is a further surge and if number of cases really increase which requires ICU support.